So just as mentioned there, I'm the advocacy manager with Fighting Blindness, and Fighting Blindness is a patient-led organisation which funds research with the goal of finding treatments and cures for blindness. We also provide information and support for people and families affected by vision loss through our counselling and support services. And through education and advocacy, we work to empower the 246,000 people in Ireland who are living with severe vision impairment and blindness. I'm also affected by vision impairment myself. I have a condition called Stargardt disease, which is a rare genetic form of degenerative blindness affecting central vision. So I suppose with those two hats, I am going to talk a little bit about the UPATI patient expert training course and my experience on that course, and how it has impacted, I suppose, my personal experience and how it's impacted me, but also the benefits of it to Fighting Blindness as an organisation and what we've been able to kind of put in place as a result of that as well. So for anybody who isn't aware, UPATI stands for the European Patients Academy on Therapeutic Innovation. It's a European-wide project and has run 2 courses now at this stage, and the third one will be starting this year. So I completed the second cohort from September 2015 to December 2016. The course aims to provide training and skills and knowledge for patients and patient advocates in medicines research and development, with the aim of, I suppose, enabling people, empowering people to contribute meaningfully to to medicines research and development processes. So the content of the course runs very much from the very beginning of drug discovery and planning of medicines development through non-clinical testing, exploratory and confirmatory testing, clinical trials, regulatory affairs, medicinal product safety, pharmacovigilance, health technology assessment, the whole way from start to finish. And so I suppose it's a lot of content. It is run online as an e-learning, independent e-learning platform, and over a 14-month period. And then there are also 2 face-to-face week-long as part of that as well, activities where all the participants are brought together. So as I mentioned, there's a lot of content, and just to mention that the content that was developed for the course is publicly available on a toolbox, the UPATI toolbox, so that's at upati.eu, and that's been really, really useful for me since, and I know it's widely available, but it's there to be reproduced and to be edited and is available for use for everybody, and it's something that I've definitely gotten a lot of use out of since in terms of, you know, articles that we can share with our members and things like that. So that's there and it's publicly available, and it's a wonderful resource for everybody. The participants on the course come from a really wide range of disease areas and come from countries all across Europe, and they're made up of people who are living with different conditions, parents of people who are affected by different conditions, and then really passionate patient advocates who are volunteering and working for local, national and European patient organisations. So it's a really diverse group of people, and that group of people bring a really wide range of experiences and challenges and knowledge to the course, and for that reason, the network that's been developed through UPATI and the face-to-face meetings that we did as part of the course were by far the most valuable element of the whole 14 months. And I suppose because it's such a diverse group and because people are faced with so many different challenges and are at so many different stages in terms of advocacy work and what they've done in the past, it really was a really rich learning environment. So, for example, a lot of the conditions that we work with in Fighting Blindness, including the condition that I have, has no therapy. So the concept of kind of benefit and risk and weighing those up and adverse reactions and all of that kind of area was something I didn't really know a lot about. But when you're in your workshop then with somebody maybe who works with MS, where there's lots of different drugs and there's different adverse reactions and different side effects and all of those things, and you get their experience, you learn far more from that than you would, obviously, if you're just reading something online. So when it's all coupled together, it's really, really valuable. Since the course is finished, that network is still in place, and that group of 100 people now, so from the first course and the second course, is there as a resource to me if I ever have any questions, and it's really, really invaluable. And that network is something that I'll always have now and I'll always be a part of, and I think that's probably the one thing that UPATI offers that is really, really unique and really powerful. So in terms of my kind of personal experience and my reasons for getting involved, before I started UPATI, my role in fighting blindness was around managing communications. So it was website and social media, newsletters, PR, all of that. So it was really nothing to do with this area at all. But as was mentioned there, my background is health promotion. So I kind of had itchy feet in the communication space anyway, and was looking for something a little bit meatier, I suppose, to get my teeth into. And then when UPATI came up, it seemed like a good opportunity. But also, I suppose, from my own personal experience of having a condition where there is no therapy, but there are a lot of clinical trials, and I suppose keeping up to date with all of those, it seemed like something that would benefit me personally if I could get more involved in that space, and maybe there's something I could do to push things along in my own disease area as well. But I was also very much encouraged by Fighting Blindness to do the course, and obviously the organisation it's a patient-led organisation, could obviously see the value in this, and was very, very supportive to do that. So that was kind of my personal reasons, and then Fighting Blindness really, really encouraged it. So as a result of doing the course, I suppose 14 months is a long time, and a lot changed in the organisation and in the vision research space in general. A lot of conversations started around, a lot of movement started around things like patient-relevant clinical endpoints and clinical trials. The traditional endpoints maybe that were being used weren't really relevant to patients and weren't really measuring the type of vision that people were really wanted. So, like, for example, if night blindness is the main thing that affects you, and the main thing that's a problem in your vision loss, then there's no point in using a clinical endpoint that gets you to read an eye chart in the middle of the day. So things like that, and the kind of patient involvement movement kind of really started in Fighting Blindness, in international groups, so Retina International, and all of these conversations started, and obviously the whole area of public and patient involvement really changed in that time in Ireland as well, and the HRB strategy and so many other things that Derek will talk about. So my role completely changed in Fighting Blindness as these different conversations started, and I now had the knowledge to be involved in those conversations and the skills to interact in these activities. So the result of that was really a big change in the organisation, where I no longer have anything to do with communications and social media, and now I'm the advocacy manager. And there is a really, really big focus on patient involvement and patient engagement within the organisation, which I think there always was, but it wasn't structured and it wasn't very well organised. It was always part of the ethos, but now it's formalised, and we have done a lot of work around that. It's still kind of at the beginning stages. We've developed a new strategy. We're developing what we're calling a VIP network, which I came up with the idea of the last time I saw Katie Scott speak and was totally blown away by her presentation. So we're obviously nowhere near that level or anything like that, but it is a start. And so our VIP network, Visually Impaired Persons Network, is a formal structure that we're trying to put in place, where we will have a group of people that we can who want to get involved, that we can provide support, provide information and training, and enable them then to get involved in different activities. So it's very much kind of at the beginning stages. I suppose traditionally we would have had a core group who were very active, and because they were very active, and I suppose probably by the nature of geography and accessibility, very Dublin-based, we would have been calling on the same people a lot of the time to do different things. And those very active people are not necessarily representative of people all over Ireland who are living with vision impairments. So this is a much more national approach, trying to get people from all over Ireland and support them then to be active in different areas. So one of the, I suppose just a couple of things, we've had 2 people, we've supported 2 people through the process of providing scientific advice to the European Medicines Agency in the last couple of months, and then we've also been able to offer people opportunities to participate in focus groups such as the Patient Narratives Project, which Derek is going to mention as well. So that's just, I suppose, some of the experience and how that's changed the role within fighting blindness. I suppose personally then, it's just given me a lot of confidence to, I suppose, more confidence in the value of the role in terms of patient involvement, more confidence in the fact that I have a right to be an equal partner, to have a seat at the table, and you know that we all have that valuable experience to give, and I suppose as well, importantly, are able to explain the benefits to people and the value of patient involvement, and what it will mean for them and why they should do it. So yeah, it's just been a really valuable experience, and the 3rd round is about to start in September, and we were overwhelmed in fighting blindness with people wanting to take part. I think there's about 6 applications from our organisation alone, because there is such an appetite there for it, and hopefully a couple of them will get in. It will make my job a lot easier in terms of building capacity among the membership in the organisation. Thank you.
Thanks so much, Caitriona. I hope you don't think I'm rude, but in the interest of saving time, I've agreed with Derek that I'm going to keep his bio very short, and there's a bio anyway in the pack that you got this morning. But Derek is going to share with you today over 10 years' experience of patient engagement and with the scientific communities, multi-stakeholder management and advocacy. So thanks very much, Derek.
Thanks, Sarah, and thanks for that very brief introduction. Some of you may remember me, as Troy McClure might say, from Sandra Galvin's video. I presented at this event last year, and I had to qualify. We presented a video, and I was wearing the same suit in the video as and it happened again. So my clarification last year was that I owned more than 1 suit, but so now I own more than 2 suits. So yeah, so I've been involved in patient involvement. I'm the CEO of IPOSI. For those of you who don't know IPOSI, I'm not going to tell you all about IPOSI. Our website has been completely regenerated, and there's a 2-minute video on there that I think just encapsulates what we do. I think if I was to sum it up in 4 words, it would be around evidence-based patient advocacy, because as we've seen in recent times, I think that when people come across patient organisations or see patients contributing to different debates or marching, that very often it's for access to treatments. And I think that the Orkambi issue is a perfect example of that, where you had a patient organisation that is one of our members that has been heavily involved in research and development and encourages its members to get more informed about this whole area of medicines R&D, but then had to go and literally go and march for access to treatment. So patient organizations often find themselves in that divide, really, of trying to encourage their members to become more informed and more involved in processes, but at the same time having to go on to radio shows and march to the Dáil to try and get access to treatment. So it's a very tricky situation that patient organisations find themselves in. And often they rely on organisations like IPOSI, who act as an umbrella for those organisations, to deal with issues that are of common interest to them, to engage with research communities, different types of researchers, both public and private, and indeed industry. So we act as a platform between the patient organisations, science, and industry. What I would emphasize as well is that, certainly for people in the audience here, is that we also accommodate individual patients who are not affiliated with organizations, because from our perspective, that's how patient organizations often start. It's an individual sitting at a kitchen table with a group of other similar individuals looking to either raise awareness or to do something to help improve either their own lives or the lives of those they care for. So we've embraced the idea of the general advocate. It's a much trickier one than, say, a patient organisation employees, such as Caitriona, who is ultimately, I guess, accountable to their organisation and to their members. But it's definitely something that we want to emphasise today, that IPOSI is patient organisations and individual patients. And what we find is, as has been mentioned already, I think Katie alluded to it, in terms of the hierarchical rhetoric that we come across in terms of embracing patient and public involvement, that certainly there is some way to go, even in the UK, who has been funding and implementing PPI for about a decade now, of walking the walk at the highest possible level. And there are certainly challenges to it, and we can't run away from those challenges. But slowly but surely in Ireland, we're starting to address those challenges through supports, through networks, through education and training. But the truth is that many patient organisations don't have the resources to fully dedicate people and funding into PPI, and it's a clear issue from our perspective. And one of the main issues that we see is that often the perfect is the enemy of the good, that when organisations come into this space and think about it from the point of view of their own values, their own ethos, that they try to create a perfect situation or look for the perfect patient. And it just doesn't exist. And I came across this campaign a couple of months ago run by Intermarché in France, which was looking at how ugly fruit and veg doesn't actually make it to the front shelves. And there's no reason for this other than for visual purposes. And this is just a perfect example of the perfect being the enemy of the good. There's absolutely nothing wrong with that apple. But what you'll find is that the supermarket will just chuck them out rather than even offer them at a discount. So again, it's something that we come across as an organisation. So we've been in this space for over 10 years now, and our organisation is led by patients, our board is led by patients, and it's very much about creating roles and responsibilities for patients in the processes and the decision-making that is made on their behalf. And our moniker is turning patients into partners. And our key priorities are that kind of balance between encouraging involvement in health research and policy, but also becoming more active in our advocacy work in terms of improving the environment for patient access. And we run a whole load of different types of activities, and members of patient organisations and individual patients and carers, indeed, are welcome to join. And I guess today was about Caitriona as an example of the kind of patient leaders that we're starting to see come through from people who actually come to events like this, not really that familiar with the environment, not knowing what to expect, and finding something within either themselves or their families or their networks that resonates with them and encourages them to get more involved. So many of the UPATI fellows who have graduated with Caitriona have actually gone on to do amazing things, and they were sitting in rooms like this only maybe a year or two ago. So I'll just summarise what we've seen. Many of you may not be that familiar, but PPI in Ireland has come a long way, even in a very short space of time. In 2008, there was a national strategy for service user involvement in the Irish Health Service that basically sat on a shelf. But many of the principles are now starting to be implemented in Ireland. Certainly in the area of mental health services, they've done a whole pile of work on this, and it's really encouraging. We have our own patient narrative project on person-centred care, which we're launching next month. There's a patient experience survey in hospitals starting next month, and the NCEC is here today, I think, with their PPI values. The Health Research Board, the PPI reviewers and the PPI Ignite has started, and it's already been mentioned here. But there are some European directives coming down and some national bills being put forward that are going to be very, very relevant for patients going forward. But it's important to emphasise that this is all happening now, and it's very, very encouraging, and it's certainly encouraging to see the appetite that's there from the HRB PPI reviewers, who had several hundred applications for only a couple of places for reviewers, which shows you the appetite that's out there. In terms of the interest in the UPATI course, it's been very clear to us that if you look at where the UPATI fellows, and they all graduated at the end of last year, there was 96 of them, and Ireland is way up there in terms of the number of fellows. If you think about the population of Ireland versus the population of these other European countries, and it's very obvious to us, the 2017 course, of the 154 applications, 23 were from Ireland, as Caitriona has mentioned. So we're very confident that there will be a greater number of these, what we define as expert patients coming through. And in our own offices out of Camden Street in Dublin, we're coordinating to over 20 national platforms as part of the UPATI project that are encouraging these public-private partnerships to develop up and to encourage greater patient education, because we see this as, some people might say that this is the cart before the horse. You're educating patients about something that there's no opportunities for them. But very much we see this as something that needs to happen first, or indeed in parallel to those opportunities being created. Because if one side doesn't see the value or the experience from this educated cohort, they're not going to engage as well. Because we actually see a change in the people who've gone through this course in terms of how they see themselves. Not only in terms of their own confidence and their own, expertise, but in terms of their willingness to engage with different stakeholders, with different entities, with different agencies. So it really does imply a shift in the way that they ultimately see themselves. And this is both patients who are part of patient organisations and indeed individual patients. And I would encourage anybody to go onto the UPATI toolbox. And just to let people know that under IPOSI, we're going to be running an equivalent course in Ireland. It's going to be a synopsized course. Caitriona mentioned that the ask in terms of the UPATI course is quite significant. It's 14 months, it's over 250 hours of e-learning, it's 2 weeks face-to-face. Well, we're paring that back and making it very much relevant to the Irish context. Who are the agencies involved in Ireland? Why are they there? What decisions do they make? And how can they incorporate patients into their processes? So we'll be running that later next year, and I would encourage anybody to sign on to our newsletter, because you'll be getting updates on that. We do have a parallel project that we've been running. I felt I just had to talk about it today, because it's very much about how research can then be incorporated within the health system, which is a real gap in Ireland compared to the UK, where research is actually embedded within the health service. And we're working with the HSE on a project around person-centred coordinated care, which is the idea that you actually ask patients what they would like to see from their health service, which has never actually happened in Ireland. So we're launching that at a big international conference in Dublin in early May. And then just to finish, that in terms of the way that research is changing and in terms of how PPI can improve the quality of research that's being generated. Certainly we see patient registries and patient organisations being involved in using technology to garner patient evidence that can be used to support decision-making in Ireland. Certainly one of the reasons why Orkambi was able to get through was the role of the patient registry in terms of monitoring the patients who are on these drugs and producing evidence to show their adherence to it. And we're also seeing some more innovative use of technologies, such as this was one done by the Alzheimer's Research UK. Some of you who may remember Stephen Simpson from Science Foundation Ireland. So Stephen is working for the AR UK, and they've got this project where they used an online platform to look at people suffering with arthritis. Anybody with arthritis would actually tell you they're able to predict when the weather is able to change. So this project was called Cloudy with a Chance of Pain. And it was very much patient-led, using their mobile apps to monitor how their reaction to the changes in weather was happening. Something funded by the charity, which they felt was far more patient-focused. So this is very much the way that research is going to be changing. And it's important that our national regulations and legislation change alongside that to encourage greater use of this. Here's the take-home messages. Thanks.
Thank you so much, Caitriona and Derek, for that valuable contribution and I suppose highlighting the value of peer networks and in education and evidence in the area.